impacted by the pandemic in different parts of the country. It need not be said that the COVID-19 pandemic is having a devastating impact on people, communities, and economies, including health and eye care. The very close proximity that eye health screening and testing mechanism necessitates makes both the service delivery and the receiver vulnerable to exposure to the coronavirus, and therefore evokes concern and fear of contracting COVID-19 and also infecting family, friends, and neighbors. We have been witnessing the closure of outreach activities for a larger part of the year, and with lesser outreach activities across the country, it is the people in the villages and the remote locations who have not been able to access eye health care services optimally. All of this has been compounded by fractured transport systems and other facilities and the lack of therein. Last year, around the same time, India and all of us in the eye health sector were particularly rejoicing with the publication of the National Blindness and the Visual Impairment Survey 2015-19 report, which stated that the estimated prevalence in the overall population of blindness was 0.36 and was inching closer to the desired goal. But the COVID-19 has in many ways reversed the progress and further mounted the backlog that the country needs to tackle. At the same time, the World Report on Vision has promoted people-centric, integrated primary eye care systems. This ensures even more significance in the COVID-19 pandemic era, as integration alone will ensure sustainability and continuity of the eye care service. Mission for Vision's own experience with our vision centers in Kolkata amply demonstrate the efficacy of primary eye care during the pandemic, despite some of them being located in or near the containment areas. In the first webinar, which many of you would have attended, we heard eminent speakers advocate the need for technology to cater to and strengthen universal eye health delivery and management. In webinar 2, we will take a move and we will talk about approaches to reach out services to the last person in the community. We have seen that in spite of the COVID-19 pandemic, many organizations have adopted their practices and approaches to ensure that they are able to reach out to the last person in the community and provide eye health services. Today, we will be hearing of the experiences and approaches adopted by some of our partners, which we are sure will be a learning for all of us to emulate, incorporate, adopt in our own settings to enable eye health to the very last mile. No doubt, there would be some very good examples to learn from also. Today, we are very honored to have with us eminent personalities to share their rich experience and wisdom, each of them a leader in his own domain. It's almost special as Mission for Vision has been partnering with all of them. Please join me in welcoming Dr. Uday Gajiwala, Dr. Rajesh Saini, Mr. Subhish Kuyadil, Mr. Aaron Basaimoit, and Mr. Satish Girija. We will have an opportunity for a question and answer and discussion session at the end. We will encourage all of you to post your questions either on the Zoom chat box, the Zoom question and answer session box, or for those of you attending on the webinar to post your questions on the YouTube link there. Dr. Uday, may I kindly request you to please honor us with the keynote address. Dr. Uday is very well known in the eye health sector. He holds a master's MS in ophthalmology from the MNJ Institute of Ophthalmology, Ahmedabad, and has contributed immensely to the eye health sector over the decades. He is involved in CBR of VI and has worked in rural tribal areas to serve the underprivileged communities. He has a keen interest in infection control practices and has also authored a manual on infection prevention. He's been involved in conducting many epidemiological studies and has been invited to review numerous scientific journals. At the moment, he's the superintendent of Tejas Eye Hospital, which is established and run by the Divyajyoti Trust. He's also a technical advisor for many organizations and has been invited to speak at international and at national events focusing on eye health and ophthalmology. Over to you, Dr. Uday.
Thank you, Sabitro. And good evening to all of you. At the outset, I would like to thank Mission for Wisdom for giving me this opportunity to talk about our experience at Divi Jyoti Trust. I hope my screen is visible to all of you.
Yes, Dr. Uday, it is visible to all of us.
Okay. So Divi Jyoti Trust is involved in providing high quality, affordable, comprehensive eye care services to the surrounding population, which is tribal population by and large. Located in Mandvi town of Surat district in Gujarat, the population of the town is 25,000. There is no railway line coming to Mandvi. It is at the beginning of the tribal area of Surat district. Major part of the population consists of landless laborers. There is no other eye care provider in the area, and that is the reason why we are here. And we are the nearest eye care facility for a population of 2.5 million. Divi Jyoti Trust provides a comprehensive, complete package of eye care, including prevention, promotion, cure, and rehabilitation. Tejas Eye Hospital, run by Divi Jyoti Trust, is a 100-bedded tertiary eye hospital with 3 satellite centers, 2 under public-private partnership with the Government of Gujarat and 1 with another NGO in nearby area. We have 8 vision centers. Then our training center caters to the training needs of all different cadres of eye care. We are involved in providing short-term and long-term training to ophthalmologists. We have a vision technician and ophthalmic nursing program of 1 year duration, which is a certificate course, a 4-year degree course in optometry, and other training programs for the paramedicals involved in eye care activities. We have active rehabilitation program. We have rehabilitated close to 500 individuals by now, and we run a small hostel for blind students also in our area. So till date, we have seen more than 650,000 patients in outpatients clinics. We have performed more than 89,000 eye surgeries by now, which includes more than 1,100 corneal transplants. We trained more than 100 ophthalmologists and more than 200 paramedics over these 10 years. And as I said, we rehabilitated close to 500 individuals. It's a small drop in ocean like contribution of Divi Jyoti Trust to the mammoth eye care needs of the country with a 1 training center, 3 service centers, and 8 satellite centers. That was about Divi Jyoti Trust. Coming to the pandemic and its perspectives, the threats presented by the corona pandemic, as Subitro has already mentioned, the workload has dropped everywhere, and the reasons are obvious: limitations in terms of transportation. Even today, transportation is not completely restored in rural areas. We are forced to maintain social distance, we are forced to wear masks and do frequent hand sanitization. The number of surgeries that we can perform in given period of time has gone down because of the changed and stricter protocol to prevent ourselves from getting infected or from transmitting infection to our patients. Naturally, all of us will have apprehension about getting infected ourselves. Then there is a major issue of finance. There's an additional cost due to the changed protocol. There's a cash flow crunch because of the reduced amount of work at our end. Donations have reduced because the activity at the end of the donors also has gone down. Then less funding coming in from the government as reimbursement because less number of free surgeries are getting performed at our end. And that has culminated into survival issues for some of us. Not just that, Corona is going to be there. Apprehension is that it will be there till end of 2021. And so all of us need to learn to work under the new normal. However, listening to several webinars right from the beginning of the corona pandemic, we had understood that the patients are there only. They are there in their households. They have not gone anywhere because there was no opportunity available to go anywhere else, nor any new player has come in the area to provide services to the patients. So the advice was that just quietly wait. It's just a question of time and patients will come back to you. So what we did was, till 11th of May, there was a complete lockdown. Hospital was functioning only for emergency cases. We were seeing 15-20 OPD patients a day, and we performed about 15 emergency surgeries during that period. After that, during unlock phase 1, regular OPD was started, and come June, the work increased substantially. We started field work also. We reached out initially to the previously diagnosed patients and encouraged them to come for surgery. From July onwards, we started asking patients to come together centers on fixed days. Outreach team was encouraged to reduce dependence on camps for last 2 years. But our own mindset was not allowing that to happen, and Corona paved way for that welcome change. As ICAMs were not allowed, the outreach team had to ask patients to come to the vision centers. But to their surprise, patients started coming to the vision centers in good numbers. However, even today, restrictions are in place and even vehicles have to run at half the capacity and social distance has to be maintained at the base hospital too. So we are not able to bring too many patients to the base hospital at a time even today. But let us quickly look at our performance. In terms of OPD patients, month-wise, April and until middle of May, the OPDs were closed. Towards later half of May, we started working and OPDs started building up. June was good. Till July of 15th, we were sailing smooth, and suddenly corona cases started appearing in our area and work dropped again. Then in the early September, in at least in our area, cases started decreasing, and then as you can see, the number of cases started increasing again. In terms of number of surgeries, April and May, there were no surgeries referred. But June we started, as I said, we started fieldwork and then the patients started flowing. Later half of July, because of the corona cases increasing, the work dropped again. But in September, it, as I said, started coming back to us. Badoli is a different story. I don't want to narrate the story here. And Umarpada, the staff himself has a health issue, so you're not seeing the numbers going up, but the other centers have started doing well. So if we compare the performance in terms of OPD over last 3 years, almost 50% of the volume has come back, and this is in spite of the fact that the OPD was closed, almost closed for 2 months, and for almost 1.5 months during the corona cases coming up, the work dropped substantially, and still the overall volume is in a close proximity of about 50%. Some centers are seeing 60%, some are still at 30%, but average is 50. If you look at the surgeries, now this is a little different story. Here the patients are centers, and that is why The OPD is still in the tune of about 50-60%, but the number of surgeries referred through the vision centers in some of the centers has reached 80-90% level also, and overall it is 60%. So that is the importance of having vision centers and the importance of field workers doing door-to-door visits, identifying patients and referring. These are some of the images of the activities going on during the pandemic. The staff had to be trained repeatedly in following the protocol, and even after repeated training, I cannot boast to say that they are following all the protocols 100%, but I would say they are doing fair enough, and has remained only about 10% of the total staff strength of 140 odd individuals. So these are the different centers, and as you can see, even on the non-mediatic fundus camera, there is a breath shield installed. So we try to make sure that they are given the best environment to work. And teleconsultations were really very helpful during this time. However, we are providing teleconsultation right from the word go. During pandemic, this really became a boon for the patients. These are some of the pictures of the field workers doing door-to-door visits and giving referral slips to the patients who need cataract surgery. So torchlight examination and referral slip filling up is going on. I would like to mention about two more experiments that we conducted in Seva Rural. One was our comprehensive eye care project between 93 to 98, where paramedics only conducted all the field work, and in a population of 2.6 lakhs, we could create cataract-free zone in 5 years' time. The other experiment was combining primary eye care with rehabilitation activity that we started for the first time in the year 2000. And if I am not wrong, Elizabeth was the country director of Sightsavers at that time. And she encouraged us to take up this challenge, because that was being done for the first time in the country. CBR workers were trained over 1 week period in providing primary eye care, and we could reach out to each household in the project area. And later this experiment was replicated by Sightsavers in other parts of the country. Later on, our enthusiasm increased and we added blood sugar testing, then we added non-mediatic fundus photography, we added blood pressure checks, intraocular pressure checks, and that really made the activity comprehensive. And now we are planning to use technology, a mobile application, to record the patient details by the field workers in a smartphone. And Government of Gujarat has already developed the software for that. So the approach is to reach the last person. There are two ways: reach out and reach in. Reach out is expensive activity, whereas reach in is less expensive and less HR requirements are there, and that is the correct approach, because patients ideally should come to us for their own health problems. So the Vision Center provides access for all. That helps in providing universal eye care to everybody. We can, as I showed, make the activity really comprehensive, and this can be taken close to the doorsteps. It is an affordable activity. It will complete the cycle of care. It takes care of the need of chronic care, because glaucoma, diabetic retinopathy, these patients have to come for follow-up very frequently. And for poor patients from remote areas, in interior areas, it's difficult to reach the base hospital. So Vision Center provides a very good alternative. And case finding also can be done in a timely manner if we have field workers in place. And technology, as shown in the previous webinar of Mission for Vision, can help us tremendously. What Vision Center can do is provide comprehensive eye care to a population of 50,000. And as Arvind Eye Care Systems keeps claiming, they have reached about 65% of the community over a period of time. And that is the best thing that we can do. So to end, what is the opportunity that is created We can promote the rich-in approach by reducing dependence on iCamps. That will become cost saving. Our HR requirements will go down. Footfall will increase at the vision centers. We can conduct field work in the service area. Technology will help us, and even Government of India has allowed teleophthalmology services now, and there are many softwares available for the purpose. So when we do a SWOT analysis, we talk about converting threats into opportunity. This is really a threat which can be converted into an opportunity to reach out to the last person in the community. So to end, the take-home message is we can strengthen our vision centers by doing field work in the service area of the vision center, can conduct door-to-door screening, we can collect patients at vision centers, and study the other successful models of other organizations, can reduce dependence on ICANNs by making use of technology. Thank you so much.
Thank you, Dr. Uday, for that wonderful presentation. Dr. Uday spoke about the need for, he started off by speaking about the growth in his numbers in his own setup, and also how he has ensured that in spite of COVID and the pandemic and the impact which has racked the economy and the communities all around, his numbers, the hospital's numbers, continue to grow and make a significant impact. He also highlighted the need for the reduced dependency while reaching out and to make sure that we use the available technology and other modes to reach out to the people in the community. Moving on from the tribal hinterlands of Gujarat to the hills of Siliguri. Our next speaker is Dr. Rajesh Saini. Dr. Rajesh Saini moved to the field of eye care management and administration after completing his MPhil in Hospital and Health Systems Management from the prestigious BITS Pilani. He has over 10 years of experience in eye care hospital management and is also a life member of Academy of Hospital Administration and a member of the Asian Society of Quality in Healthcare. Currently, he is the Chief Executive Officer of Siliguri Greater Alliance Eye Hospital that focuses on bringing quality eye services through its network of hospital, tertiary and secondary, and his wide network of 22 primary eye care centers. He is also the current national coordinator for Vision 2020, the Right to Sight India. Over to you, Dr. Rajesh, for your presentation.
Thank you, Shavitro. Now I can share my screen.
Yes, please go ahead and please share your screen. You'll be.
Yeah, my presentation is visible, Shavitro.
It's coming up. Yeah, it's visible. You can move on to the slideshow format.
Yes. So first of all, thank you very much to Mission for Vision. Thank you to Dr. Uday Gajiwala for setting the tone. We all today are having the togetherness for this wonderful webinar, which is addressing the community outreach need. Siliguri Greater Alliance Eye Hospital, established in 1981. You can see in the picture the Unit 1, and then Unit 2, established in 2017, which is a community outreach 100-bedded hospital. Also, education and training need hospital to serve the eastern and northeastern part of the country. Last year, we performed 18,000 plus surgeries with both the hospitals. The Unit 1 hospital is a tertiary hospital having all eye care subspecialties. Our vision is to be a center of excellence to provide quality eye care services for all, with the mission committed to provide excellent, affordable eye care services through dedicated teamwork and making it accessible to all in eastern part of India. When we say vision centers, so Siliguri Greater Alliance having a reach in entire North Bengal with a radius of 250 kilometers and having a reach with 22 vision centers at present, and extending our reach in near future in the state of Bihar and Sikkim with 12 more vision centers in the planning phase. Dr. Uday Gajiwala set the tone very well. So COVID-19 pandemic and we have gone through a lot of new terms, and one of the term which is now very catchy in our ears is lockdown. So lockdown affected everyone's life, economic, social, everything. It affected health. It affected eye health indeed. We all were affected in our hospitals with services, only emergency services we were providing, and elective surgeries were not being done in the initial part of the lockdowns. Effect was obviously decreased cataract surgical rate, and also the organization have to take a call on the payrolls, pay cuts, and also there was a question on financial sustainability. So this is one of the slide from PHFI, which says that in the initial part of the lockdowns, the outpatient volume have decreased to 75%, inpatient decrease, surgical volume decreased 75%. And there is a fear and apprehension in the patient's mind that the hospital will be a transmission zone for COVID-19. In addition, the healthcare workers having mental health issues because they have to be in forefront and dealing with the patients and also communication with the people with disabilities. But we did not stop adapting to new normal. All India Ophthalmological Society released their guidelines, NPCB released their guidelines, and we had enough of the literature and webinars that the lockdown adversely affected the lives of visually impaired people, and we need to address that. So Siliguri Greater Alliance Eye Hospital also drafted their own guidelines, considering the infrastructure we have, considering the building, considering the vision centers we have. We trained our staff internally, and we were in the principle that we have to give the safe environment to the patients and serve patients with safety and quality. So we created that environment and we circulated within our groups, within our patient groups, within our beneficiaries, that Siliguri Greater Alliance Eye Hospital is a safe eye care hospital for all your eye care needs. These are glimpses of the safety measures. We also created this same safety at our vision centers, thanks to our supporters, Mission for Vision, Operation Eyesight, Sight Savers, who have really guided us that we can do our outreach activities in this pandemic also. So we proved to our patients that we are creating a safe environment for eye care. So our patients were happy and the impact was there, and we are still learning. So if we compare the OPD, comparing the OPD, we can see the percentage, this second graph, if you see the percentage increase in the OPD at the base hospital at Unit 1. Our Unit 2 was taken over by Government of West Bengal as an isolation center, and it is still with them. But from May to October, if we see the OPD at the base hospital from 24% to 90%, we have achieved. There was local lockdowns in between July and August. That's why there was a dip. But considering the October month is a Durga Puja month, still we achieved good OPD in those periods. Now coming to the surgeries, the surgical volume, as Dr. Uday said, initially in May and June, it was very less. Comparing the percentage with 2019, from 9% to 149. Out of this, the total paying surgeries at Unit 1, starting from May to October, if we see that from August onward, we started picking up, and in September, we achieved 137% of the paying surgeries, and in October, though it's Durga Puja month, we achieved 234%. Yes, the contribution is obviously from our vision centers. The vision centers referred surgery comparison between 2019 and 2020, though the number of surgeries referred from vision center is less comparing to 2019, but these all are actually paying and subsidized surgery. So we take a conscious call that we need to focus on those patients, those who are referred to the base hospital for paying surgeries. And also we need to check that those who cannot afford should not be deprived of the treatment. So effect of vision centers, because we didn't have Unit 2 with us, so we can do limited number of volume. So we stressed on counseling at vision centers for subsidized and paying surgeries for those who can afford, received significant pay and subsidized surgical cases from vision centers. We were sure that we need to provide transportation as per the COVID guidelines to these patients, and we provided that. Created a trust in the community, and also considering the infrastructure, we provided the shifting duty to our hospital staff so that they can feel comfortable and they can do their job in this pandemic. So comparing to the vision center OPD performance, in May, it was 17.37%, only 10 vision centers we first started in May, but gradually when we started all, if we see that more than 100% achieved as compared to 2019. Similarly, with the spectacle dispensing at vision center, starting from June to October. The uninterrupted eye care during COVID era, we need to adapt to the new normal, reaching to the community. And usually we have community health workers, but addressing the pandemic, we adapted a new approach called voluntary health workers, where the staff were previously trained, but they are not at present our staff. We offered them a TADA monthly basis so that they can work with us and they can do the door-to-door screening. We provided them a 1-week refresher training and then they started their work. Yes, the Netra Vasant Rural Eye Health Program, which is supported by Sightsavers, we adopted this voluntary health workers approach and we started doing this door-to-door screening. You can see the primary screening, near 19,000 plus screening were done in last 4 months under this program with all safety norms. Similarly, school eye health, we all know that the children are sitting at their homes, schools are closed. So we adopted the same approach with voluntary health worker approach in school eye health also. And in the 2 months of September and October, we did screening of 8,000 plus children. Yes, sustainability is important for all of us, being eye care institutions. The revenue generated from Unit 1 for our hospital is utilized to serve more free surgeries at Unit 2. So comparing with June to October, we have a comparison that gradual there is an increase. And from September onwards, we are 101 and 174% of 2019. And COVID is not a barrier. We need to be focused. So we have, with the support of Mission for Vision, inaugurated 2 of our vision centers recently in the month of September, one in Darjeeling Hills and one in Kuch Bihar. So it proves that vision centers are the necessity in this COVID pandemic because of the patient transportation issue. We also started our teleconsultation and online appointment system. Gradually, it is also improving. Learnings, important is the learnings. So invest in preparedness and adaptation. Best way to minimize the health issues and social and economic issues is we invest in preparedness. So COVID-19 will not be the last pandemic. Transform our work as per the need and future. A strong quality eye care system will always help. And it always allows to manage the tough times like pandemic. Self-belief and ready to take challenge attitude. Creating leaders. Always create a belief system for both internal and external customers, ensuring safety with quality. Learnings, further strengthening the primary eye care networks. Technology will play an important role and community participation. Adaptation to start more rural cataract surgical centers, which we are going to start 2 more cataract surgical centers in next 6 months. Last slide with this photograph in which again, one of the health worker is carrying a cataract patient from the rural village to the base hospital. Thank you very much.
Your mic is muted, Sabitra ji.
Thanks, Suvesh. Yeah. Thank you, Dr. Rajesh, for that wonderful presentation. Your presentation threw light on the need for being prepared, on the need to adopt and to adapt to the newer changes and embrace the systems and move ahead, keeping in mind safety of the employees, of the staff, and the community in mind. And you also highlighted the need for working along with the community to make the changes and to move ahead. Our next speaker this evening is Subish, Mr. Subish Koedil. Subish, as he is fondly called and known by everyone, is a postgraduate from the London School of Hygiene and Tropical Medicine and is currently heading the Center for Community Ophthalmology at Sadhguru Netra Chikitsalaya, with over 8 years of experience at Sadhguru and a further 7+ years of experience in the eye health sector. Subish and the entire community outreach department handles all international eye care projects, conducts extensive community outreach programs, which also includes establishment, management, and effective running of a network of 60+ primary eye care centers spread across the rural belts and the hinterlands of Madhya Pradesh and Uttar Pradesh. Over to you, Subish.
Thank you, Savitra ji. I hope I'm visible, right?
Yes,
The
Subish,
slides
you're
are-
very much visible.
Okay. परम पूज्य गुरुदेव के चरणों में वंदन करते हुए, first of all, I would like to thank Mission for Vision for this great opportunity. Elizabeth ma'am, Savitra, Mr. Daniel, and Shrikant, of course. And before I start, I also like to thank my organization, BK Jain sir, Elish Jain sir, for this great opportunity to represent Sadhguru Netra Chikitsalaya in this wonderfully organized platform. And the session start with the Uday Gajiwala sir, and we were very fortunate to start with him. It was really enlightening along with Dr. Rajesh's presentation. So very quickly, I'm going to talk about the organization, those who don't having much of idea about Sadhguru Netra Chikitsalaya, and then what is our perspective and what are the strategies we have taken so far to tackle this pandemic, which was never expected by all of us. So I'll very quickly start. If you look at our organization, we have a very long legacy, which is starting from 1950, where the founder himself organized a mega surgical eye camp. But I think what differentiates us is like even the subject is also about last mile service delivery, where we always understand the rural and remote areas is the underserved. So what differentiates us as an organization, we actually stand where the problem lies. We one of the organization who actually located in a remote and rural area. And with that, if you look at, I'm very proud to say we are one of the world's largest rural eye hospital. It's not, I'm saying this because I work for the organization, because through this rural hospital, we are able to touch 1 million patients every year. That is a volume and scale we look at Sadhguru Netra Chikitsalaya. And also proud to say this rural eye hospital becoming #1 in India. I mean, if you look at in terms of number of cataract surgery every year as a single center, we stand with that, and that is something inspiration for everyone. And we not only focus on quantity. I mean, numbers are obviously important, but equally important to have quality. So you can look at, we have 25 model operation theaters, which are at par with JC and NABH standards. And again, not only focusing on cataract, you have a comprehensive setup where you have all the specialties, including cornea, retina, and everything. And as an example, you can see we have 16 retinal surgeons, where and an average, you can say around 6,000 retinal surgeries are happening. And again, definitely we lend our hands and we learn together like we are doing in this platform today. So we have a capacity building program, and also we have a postgraduate training center where we could really help across the globe ophthalmologists. So that is something fundamentally we believe, and I mean, it's all about sharing and caring. And we do have a mission. Definitely the pandemic was sort of coming in the way as a distraction or is sort of a disturbance. But definitely, I wanted to tell you this thing very clearly. If you have organization and support like Mission for Vision and many other INGOs, I don't want to name it everywhere, but as an example, I mean, when the pandemic came in, which was very, very unprepared, so we were thought of giving foods to people nearby who have issues with the lockdown and all. So all of a sudden, I mean, even though it was in eye care, all of a sudden Mission for Vision, especially Madam, came forward and we could do a wonderful job. I think that is what we fundamentally believe. We have a vision which is very far behind, but if we have organization like Mission for Vision, definitely we are going to achieve all this thing. We still wanted to convey our gratitude. So I'm very, very precisely coming into the topic now, the primary eye care to the last mile. the perspective of Sadhguru on this pandemic. So we all know all of a sudden the pandemic came in, and being an NGO, and again, the next setback, obviously it was very genuine to take in that decision that we will not be able to conduct outreach camp during this period of time. So all of a sudden we also realizing, so now Vision Center is the the model for reaching the people in the community. And fortunate that we have 61 such primary eye care centers, which is, Mr. Sabitra also rightly mentioned, spread across MP, UP, and Rajasthan. So the history with Sadhguru and Vision Center, you can clearly see from 2003 to 2020. I mean, latest Vision Centers, we were inaugurated in Prayagraj with support of Sight Savers International. And so the difficulty was when the lockdown came in, the COVID pandemic, everybody was having a big fear. So the biggest important challenge we had was, how do we bring back the momentum? I mean, we were all realizing it is not something going to finish maybe by 1 or 2 months. It was very clear it is going to be a long battle. So we cannot really wait to get the things settled. So that was the biggest challenge. How do we bring that momentum? And I just wanted to quickly share the strategy we use so that everyone can, get inspiration from that. So there are 4 areas fundamentally Sadhguru focused on this pandemic time. One was employees, and then the community supporters. Being an NGO, you all have supporters from the community, and the public. Like Rajesh also mentioned, that the perception of public is very important. And again, the patients, ultimately the king of our service delivery. So I think employees, one specific thing, including our directors or relations, are made it very clear. Even the OPD is less, or the Vision Center, we may start it early, late, but we are not going to compromise on the safety of employee. And it's not just the words. I would say like 3 months almost we were in lockdown, but the salary gone on time, and then you have a policy for every employees. These are every organization do, but I just wanted to mention, I think this all speaks the heart of the organization, how the organization think. And also, the institution has to have training mechanism where you ensure they are equipped to handle this pandemic. Rather, you saying you have a compassion. So equally important to have an ownership in the employees by bringing a lot of measures and also training programs. And then the second part, importantly, once the employee is competent and they are fearful and they are ready to work for you because of the measurement. Now the community comes in. I just wanted to mention you. They are, part of your bigger family, and you need to ensure regular commission. I'll tell you, even we were not working anything in the 2 months, but we still were in touch with community people to know what is happening in the ground and all. Even directors send customized message to these people to tell everything is going to be fine. We are going to work together again. So that is the way it goes. And if you look at the result of that, because you can't organize camp, you can't arrange a transportation, but these people come forward, and because they were seeing a lot of patients are ready for cataract surgeries and all, so they come forward. So that is the result of community engagement. And then again, importantly, the public perception. We were mainly focusing on 2 things importantly: Vision Centers, and we were also understand not to do, because if you look at our organization, we do around 3,000 reach out camp. All of a sudden you are stopping that. But strategically, we focus on Vision Centers, and then door-to-door screening in nearby Vision Center. There, patient can come to Vision Center for further care. So we prepared our Vision Center very detailed, which is already explained by the thing. But I think it is very important too, because this is becoming a new normal. So it look very good, like to say something, okay, you have to wash your hand and come to our center. But eventually everybody will follow that. That's what our experience is. And I think it brings a lot of confidence when you say you have a thorough protocol. So tomorrow I also will go with my mother to have a checkup. So that is something we were very carefully thought of to create that perception, which is in real, in fact, to ensure people are not scared of by thinking if I go for a spectacle prescription or something, I'll get COVID. So this is something we genuinely focused. And all these practices of using different trays and all this, there are different things I don't want to mention here. But still, I think this gives you a lot of confidence to the patient where they feel they are in a safer hands. So that is how it goes. And then I just wanted to mention again, we also have fortunate to have support from Sight Savers to have a rural screening, door-to-door screening. But this time we gone completely IT enabled. We don't use any papers. Again, it's a chance for spread that COVID, a good thing from COVID, I would say. So we went to door-to-door in almost, I would say around 12 districts with the completely IT enabled. End of the day, you can come to know from your desk how many patients are got screened and how many have referred and all these things. So, and finally, I just wanted to mention whatever you do, whatever plan you have, end of the day, even our directors are also say this patient has to be taken care. Now, I'll tell you an important thing. All of a sudden, you stop the camps. You said come to Vision Center, then come to hospital, and they don't have any transportation also, public transportation also. So we started this travel allowances thing where people, if they are ready to come to hospital, they get a money. And I just want to mention, even a free patient come by themselves, they get a money back. I mean, rather getting from them. So this is sort of a thing where you, I mean, when there's difficulty is that you can't simply sit and say, okay, so this is the problem, what we can do. So you need to think as a responsible organization, and that's how it goes. And when you talk about last mile support at every point, like when they come to base hospital, again, it is a good crowded place. We have a good number of OPDs, but again, they get welcome. So, and I just want to show you the last thing. So if you look at the Vision Center was truly effective. You can see in terms of reduction in OPD was not much in Vision Centers. And in terms of, like Rajesh was showing a slide, like later by October, Vision Center is performing compared to last year. But we were fortunate we could get that performance by June and July itself through an effective community participation. And importantly, for the sustainability, which was a critical issue, Vision Centers are, I mean, if you look at pre-COVID, it was like only 4% from the Vision Centers on paid surgery, but now it is 17%. So effectively, you could do a good work for the community, but you're also getting back. It's not just you're serving the community. And I wanted to conclude with this slide. You can see here, now eventually things are coming into modem. Definitely we do around 900 surgeries a day. That is what sort of on our average, but still somewhere 50% it is coming. You can see, especially in the by end of the week, you are doing around 400 surgeries. So, and you can see the two colors, like the orange is all about Vision Center referral. So such a solid numbers are coming out, which means your strategies are working out. So I just wanted to conclude. I'm taking one more minute. I'm so sorry for that. So even we were doing 3,000 outreach camp, we never relied on that. It's meaning we had a Vision Centers to back up. So all of a sudden, we never expected such thing going to happen, but we were able to do that. And I think even if we have a success, even we can say number of surgeries are going to increase, community engagement was the key thing. And again, the employee engagement, your system efficiency, and opportunity. I think I just wanted to mention here, because there are different organizations say about employee welfare and all, but these are the difficult time where actually you get to experiment what organizations stand for, what is the fundamental thing which organizations stand with. And again, I think we have different issues, including FCRA now. I think all of us are looking at now to become more efficient, so that we also know the survival is only for the fittest. So I think a lot of good learning from also, apart from the challenges. So I'll stop with here, and we do have a consultancy which we can talk from Vision for Vision. And I once again thank you for the opportunity, and thanks, and over to Mr. Sabitra.
Thanks, Subhish, for that wonderful presentation where you touched upon the entire gamut of the SNC's work, spoke about the large numbers that you have always been catering to, and also spoke of the experiences and the adaptations that you have made, which today, in spite of COVID times and the challenges presented in terms of fractured transport, the fear in the community and other aspects, because of the employee engagements, the patient safety, community participation, you're back to almost 50% and more of your daily numbers. And we are sure that with time, these learnings will be taken up by all the panelists and all the attendees on this, and would be adapted in their scenarios. And the learnings would permeate to all regions of the country also. Thanks once again, Subhish.
Thank you, sir.
Our next speaker from the hinterlands, moving on from the hinterlands of Uttar Pradesh, is Aaron Basaimot. Aaron represents the generation of eye health practitioners from Northeast. He's always been very passionate about making a difference in the fields of healthcare, education, and technology. And he can speak on about each of these topics impromptu, at the middle of the night, and go on and on. He's presently the Chief Executive Officer of Bansara Eye Care Center, Shillong, and is the Director of Administration for the Bansara Institute of Ophthalmic Sciences. He also represents the Northeastern states on the board of Vision 2020 India and is a member of the Academic Council at the Martin Luther Christian University. Over to Aaron for your presentation.
Can you see my screen?
It's coming up, Aaron. Yes, ma'am.
Right. At the outset, thank you so much to Mission for Vision's Mr. Sabisha for the kind introduction and for the opportunity. Elizabeth, ma'am, Shrikant, Sabitra, Mr. Franklin, and even Shubhrakanti, who is basically the partner for the nodal partner for us in the Northeast. So on behalf of Bansara Eye Care Center, I would like to thank Mission for Vision and everybody present here. And in the wonderful keynote that was started by Dr. Ujay Gajiwala and all the others, Dr. Rajesh, Mr. Subish. So just to share basically our perspective in terms of what we had done throughout the course of the pandemic. So a quick snapshot on most of the statistics that many people might already be knowing. But if you look at global blindness, we're looking at about 253 million people who are visually impaired and 1.1 billion with near vision impairment. 80% of all of this is avoidable, and 90% of the people facing these issues live in developing countries, and 55% of those people are actually women. So what this actually goes ahead and tells us that, you know, even across the world, basically it's not equitable, the distribution of eye care ailments. And blindness in India, as per the NPCB and the visual NPCB and VI, stated that basically 8.8 blind people out of the 36 million blind globally are in India. That's 1 in every 4. And 47.7 million Indians have basically moderate and severe visual impairment. In spite of there being good news in terms of the decline in prevalence from like 1 to 2 points, which is even lower. However, cataract and uncorrected refractive error are still the major causes of blindness. And as you can see from this map, there's still a huge disparity in terms of cataract surgical rate. For example, a state like Gujarat, which would have like 13,000 plus, like, you know, CSR, whereas basically in a state like Meghalaya, the number is just at 843 as of 2018-19. So we still have a long way to go, and there are a lot of regions basically that face this type of inequity. Globally, blindness has now become a huge issue, and almost 1 in every basically 3 people would have some form of vision impairment, according to the new Vision Atlas World Vision Report. Now, coming to about our state, Meghalaya. So as you can see, we're nestled in the northeastern part of the country, and it's a very, very beautiful state with 11 districts. It's got 3.4 million population. One point which I would like to mention is different, contrary to many other states, we have 132 per square kilometer population density, which is very low compared to the national average of 382 per square kilometer. So it results in different sets of challenges. 80% of our population is rural, and we have a matrilineal society, also called matrilineal, where basically the kinship system in which the ancestral descent is traced to the maternal side instead of paternal lines. So in other ways, or in a light way, basically, yeah, the vidai happens for the male as opposed to the female. We have an agrarian economy, and like, you know, horticulture, floriculture are very popular, and 70% of the population is Christian. As you can see, we have a base hospital, and we have a vision center network of 9 vision centers with 2 upcoming vision centers in the coming year. Our institute, basically founded by a medical director, Dr. Jennifer Wade Vasayamoy, comes and it stems from the Khasi word to nurture, or called Bansara. It started basically established as a first aid clinic in 1996. And as of today, the hospital has 9 vision centers catering to 2 million population, 63% of the state. And in the past year, we reached out to close to 72,486 patients overall. And we're the only 24/7 emergency eye care provider in the state of Meghalaya. Our mission and vision, led by our founder, Dr. Jennifer Wade Vasayamoy, was to set up a center of excellence in the field of eye care with the motto, Eye Care for All. And our mission is to eradicate avoidable blindness in the state of Meghalaya by adopting a holistic approach involving collaboration, cooperation, and convergence, thereby ensuring quality eye services that are affordable, accessible, and equitable. So what is the overall impact that we have made for eye health in Meghalaya? We have reached out to close to 8 lakh people over the years, and done almost 20,000 high quality surgeries across the people of the state. We started as a small team of 3 in a small clinic, which has now grown to a family of 90. Being in the northeastern part of the country, we already have non-COVID challenges such as high outreach expenses because of population density being very low, which results in high costs for conducting outreach, very low levels of awareness. In terms of like the district in Jaintia Hills, one of the areas where we work with Mission for Vision, in a survey of 60,000 people, only 26% people knew what cataract was, and 74% did not even know that they should get an eye test a year. This makes cataract conversion from ICAM extremely difficult. Difficult terrain makes many of the roads inaccessible once basically the monsoons hit. And once you leave the newly constructed highways, you realize the plight of some of the roads. Low affordability, people still cannot afford health like services. There's lack of trained HR, for which we have the Institute of Ophthalmic Sciences, which was founded for this very reason, so that we can have our own manpower. And other issues like lack of consistent internet connectivity in the rural areas makes it difficult for us to adopt real-time technology solutions. And to add to that, some of the vision centers still face electricity issues. As mentioned by all the other speakers, some of the major challenges for COVID is all the same. Fear of the virus, like the fact that there was so much stigma associated with COVID across the country, and which is worse in rural areas. Lack of transport due to the lockdowns. The transportation cost for villages has greatly increased due to social distancing, and supply of items even to us in the state of Meghalaya was actually a huge issue, whether it was for PPE or even it was for medicines and other essential items. There's a financial burden with many people losing their jobs and daily wage, and a decrease in consumption, and the survival that is placed that is basically gone ahead and come at the forefront, and many people have basically sidelined health. So if you look at the changing protocol, from the government and the community rules, in many rural areas, we had to adhere to basically the community guidelines, and make sure that that was also taken into account in addition to the government rules. And we had an impact of COVID during our peak season. As opposed to most other states in the country, we generally have our highest OPDs in the month of April to July, where COVID hit us really hard. And we basically have our lean season in the winters, which are generally cold. And that's left a huge dent in our anticipated patient footfalls. So as many of the speakers have already suggested and mentioned, we've already gone ahead and adopted some set strategies. And one of the most important, which we felt, was honest communication, which included communication to internal staff and external patients, community, government authorities, and donors. We were very clear right from the upfront for what we could do and what we could not do. When we did not get our PPE in time, we made sure that we took the conscious call of closing the hospital down for the month of the vision centers down for the month of April, and only made sure that we had emergency access for patients in the month of April in the base hospital. We conducted regular training through webinars, which were conducted by the hospital staff internally, and externally, learning the experience from others, INGOs, and even corporates for that matter. As a hospital, we conducted over 25 webinars from April to October, and regular meetings being led by our medical director on a weekly basis to motivate the staff for all the necessary trainings. We empowered our staff with the necessary PPE that was sourced through our partner grants. We thank MFV for mobilizing funds for PPE for our Clarion Vision Center, and we even did this directly. This has instilled confidence in staff as well as patients, and we had basically teams administration which went to every vision center after coordination with the district authorities in the month of May itself. We recognized the community and the role that they play, and we made sure that we reached out to them irrespective of all the difficulties, like what was even mentioned with Subesh. And we reached out to patients who were already identified with ailments throughout this period of time. We tried to leverage technology for management as much as possible while keeping service delivery more human-centric. Even though we were on teleophthalmology, used social media, WhatsApp groups for our vision centers, for teleconsultations, we made sure that we could go ahead and made sure there was a lot of emphasis in our tone, and we made sure that was communicated to all the staff, so that at least even amidst behind all that PPE, we could make sure we are being very empathetic to every patient's cause. We made sure there was consistent pricing. We rethought our approach to staffing and inventory management at the base hospital as well as vision centers. Things like increasing the medicines for close to about 2 months in the vision center, so that they don't run out of stock just in case lockdown happened. And we made sure that we went a little bit more, we stocked up a little bit more for 3 months at the base hospital, anticipating future lockdowns. We set expectations with patients for spectacle delivery time and even opening times for our vision center, depending upon how things were happening. And we collaborated with local taxi drivers to help facilitate the transport of goods. We segregated a high-risk staff by segregating them on the basis of what elderly patients and family members they had in their family, as well as their blood group, trying and seeing all the pregnant staff and moving them from high-risk settings to low-risk settings. And we approached companies to directly supply us masks like 3M, and that drastically brought down the costs. Now, how did the pandemic affect our primary eye care? If you look at basically the period, like how everybody shown, without COVID, we should have reached out to 12,737 patients, but due to COVID and actually being not working for close to 2 months, this was down by about 50%, and we had 6,342 patients throughout our vision center network. And if you look at it basically on a month-to-month basis, the footfalls for the year 2020 basically resulted to absolute complete halt in April, and basically started picking up as we reopened most of our vision centers in the month of May. Even though like in the month of June and July, there was a slight dip because of increasing lockdowns and also because of more containment zones in different areas. But however, by October, we've actually reached a relatively good value. And if we were to look at our performance in terms of October, we have actually have a 5% increase from our 2019 values, which is actually a very a good figure, even though we are slightly off course from our our own trajectories. But taking into account the pandemic, I think we've done a good job as an entire team. And the age and gender breakup was something that I was keen on looking into to see if whether or not the right people, the women and children, could still access care or no. And in spite of basically the pandemic and our yearly trend, we've still had a good percentage of basically women and children basically who have gone ahead and taken up our services at the Vision Center. If you look at the pandemic's effect on surgeries, as suggested by a lot of the other speakers, there was almost a 50% drop in overall surgeries as anticipated, but we're seeing a good recovery even like in the last 3 months, and only with the confidence of the community in terms of our systems, in terms of what they've seen at the base hospital and the Vision Center, they have actually come to a point where they could go ahead and say that, yes, we are heading close, and we've reached to about 784 surgeries from on post-COVID times. If you look at the income and expenses for most of the vision centers, as suggested by the other speakers, we've had increase in PPE expenses. In spite of that, we've had the vision center being closed down. But by negotiating rents, trying to drive down costs and trying to see what we can do, we were like, as of October, we've actually had a surplus of about 1,61,000. And from a 72,000, the income that is 72 lakhs income that has been generated, we had an expense of about 70 lakhs. 6 of the vision centers are sustainable and 2 are not yet sustainable. One, unfortunately, is in the world's rainiest place in Sora, which basically had the most income that comes from travel, and it's a travel hotspot. And that place has actually been hit really bad. And it basically, it results in the fact that patients are not even coming forth and for healthcare. So we're trying to reach out to the communities to door-to-door screening and making sure that we are offering them free consultation so that they can go ahead and come to the vision center and seek for eye care services. And if we were to look and contextualize the vision center data, we have some of these great institutes like SNC, your LVP and Arvind. In the Northeast, things are more challenging in terms of numbers, but we've tried our level best. And compared to some of the Northeastern states, like, in Assam, Mizoram, Manipur, I've just highlighted a small slide, showcasing basically when and how whatever strategies we used have helped us basically increase our numbers. So to see basically a state that has the closest to us, one of the vision centers had reached out to about 693 patients, whereas the vision center supported by Mission for Vision has basically allowed us to reach out to approximately 174 patients to 313 patients per month. And we've even seen an increase in spectacles sold. One of the major reasons by about 100% next to the closest Northeastern state. One of the reasons why this has happened is we've put multiple ranges that is going to be there for all strata of society, anticipating the fact that a lot of the people from the district who would otherwise travel would not be traveling. And we've reached out to them by informing the government, by the village headman, and also by having local meetings and informing the people within the community regarding the same. So this was a heartening figure to show that at least and help us understand that some of the strategies that we applied went ahead and worked. One of the major strategies that also worked was changing the WhatsApp status, for all our, and sending WhatsApp messages to all our patients for whoever we had contact details. So why should we all bother about primary eye care? If we look at the slide of estimated patient wealth and per capita income for our state, for the year 2019-20, it was 90,000, which works out to rupees 250 per day. And 36 of our population will still need free or subsidized care because their daily wage will not even cross 170 rupees a day. And the fact that the lockdown has come, it's become a huge, huge issue for a lot of the people. And like this is the reason why we need to establish more vision centers and reach out to the community, even in terms of outreach and camps. Even though vision center is the way to go, in areas with low awareness, we still need to have more outreach camps so that we can go ahead and reach out to the most vulnerable people who need our help at the earliest. And if we go ahead and understand some of the points which I thought I could put for food for thought, is how do we make care more comprehensive in the vision centers? How do we increase the vision center footprint quickly within a state? How to increase surgery referrals in a hospital in a safe manner from the rural areas? And with high volumes not being an option and difficulty in fundraising, how do we ensure equitable eye care for the underprivileged? How to go about conducting outreach in COVID-19 in difficult areas while ensuring it's sustainable? And even one very, very important aspect to which courtesy Elizabeth ma'am and the Mission for Vision team, they have put a lot of emphasis on the psychosocial impact of of cataract on the elderlies. And now I think it's very important to assess what exactly has happened and the impact due to COVID and them not coming and accessing care and how bad is it. These are areas for basically thought. And if I were to summarize all my learnings, I would say that we have to implement technology in all of our centers. We are using the Arvind Vision Center Management System for that, but we intend to even go ahead and start using tab-based solutions as suggested by some of the other speakers. But at the heart of technology, and even though I think technology has a lot of scope, we need to make sure empathy is there amongst all of us, because we would only be in a position to go ahead and treat people like in an empathetic manner and build open and honest relationships through communication. And only by collaborating with all partners, whether it's with the hospital staff, your management, your community health workers, your head of projects, your optometrists, your doctors, we would be able to achieve and win over this pandemic. And the availability and ensuring the availability of services at all given points of time, ensuring the availability of medicines and the availability for surgery and surgical assistance is what will definitely help you gain a lot of confidence as far as the patients are concerned within the community. A lot of us have been working over the years over disease-centered care, and people are talking about patient-centered care. But as mentioned by Mr. Sabitra also earlier through the World Vision Report, we are now talking about people-centered integrated care. And I think we really need to work towards human-centered healthcare design, where which is also taking into account the systems-based approach, where we don't work as silos. We go ahead and collaborate with the existing healthcare system. We collaborate with the existing NGOs. We try and reduce redundancies and make the maximum optimal use of any resource that we've got to make sure everybody benefits from this. This is just to show you some of the snapshots that are there in terms of the activities from April to October, from basically your triad stations to hand washing and to talking about the service engineers who've come wearing PPE, risking their lives as and when to come and make sure our machines are up and running. And even going ahead and realizing the fact that, we have all our vision centers and our medical director leading webinars regularly and conducting community outreach and our community health care workers conducting community outreach on a door-to-door basis. All of this is only possible through the Sustainable Development Goal 17, which is partnerships. And I feel that's the only way we can take things ahead. And I would like to thank all our partners for whatever support that they've provided to us. And I would like to end by saying that this is an unprecedented time, but it's also time for unprecedented kindness. Thank you so much.
Thanks, Aaron, for that wonderful presentation in which you laid threadbare not only your own performance and compared it with others, but also told us the need for staff motivation, communication, providing encouragement to each and every team member, adapting, using the local systems, the rules, regulations. And you also touched base on the need for innovation, be it in terms of spectacle delivery or reaching out to the community members. Thank you. We'll invite our last speaker, Mr. Satish Girija. Mr. Satish Girija is an individual with years and years of experience, fondly known as Satish Ji. He's an engineering graduate and founder member along with his other 3 friends of Navbharat Jagriti Kendra, a renowned voluntary organization working across the states of Jharkhand and Bihar. He has over 49 years of grassroots level experience in implementation of rural development programs and has worked on the issues of health, education, livelihood, networking, and advocacy, including with over 15 years in the eye health services through their 3 eye health units across Chauparan and Dumka in Jharkhand, and their newly established unit in Gaya, Bihar. He's also been a member in various boards and committees of the central government, state government, national level network, and of different NGOs. We welcome you, Satish ji, to give your presentation.
Thank you, Sumitra ji. I am very much thankful to Mission for Vision, especially Elizabeth ji, Sumitra ji, Daniel ji, and Srikant ji for giving me this opportunity. And I am also very much thankful to my earlier speakers because most of the things have been shared by them. So in the nick of time, I do not want to repeat them. Navbharat Jagatikin is a volunteer organization. This is our Golden Jubilee year. We are celebrating our 50th year. And this organization has been, as Savita told, we 4 engineering graduates have established an organization influenced by the Gandhian ideology and to establish a just society. So we have adopted an integrated approach of rural development, working on the issues of health, education, and livelihood. So under the health, we are working mainly on the eye care and disabilities. So it was Elizabeth Ju who first supported NBJK to establish one eye hospital in 2005. At that time, she was the country director of Sai Sebas. So we are very much grateful that the first hospital was established by her support, and the third hospital also being supported with her support with the when she is in Mission for Vision. So I'm very much grateful to her. So in 2005, we started our eye hospital first. Then in 2008, we started another eye hospital in Dumka, the tribal zone, with the help of CBM. And the third eye hospital thus started in Gaya district, which is very nascent stage. So we have 3 eye hospitals. And in the Hazaribagh, where we have our 2-year diploma course also, now ophthalmic assistants. So we are annually doing around over 1 lakh OPDs and around 18,000 cataract surgeries actually it is through the 2 eye hospital because Gaya hospital is very recent. It just started functioning from February 2020. So operationally, we have 65% free surgeries and 35% are paying. And we mainly cover the rural population. Because we in the rural area, they know any kind of eye care services. So we mainly cover the rural population through vision center and through eye screening camps. So in COVID-19 pandemic, we also faced, like other speaker told, that there were lockdown around 2.5 months, the hospital was closed. And after we also made our hospital the COVID center in Hazaribagh. Because Jharkhand and Bihar, around 3 million migrant laborers reached Bihar and Jharkhand during this COVID period. So we we run our hospital as a COVID center for around 1 month. So 2.5 months, the hospital was closed. And after the relaxation in June, in lack of public transport facilities, people were not able to come to our hospitals. Also, there were restrictions in movement, gathering, and camps. And village were reluctant to surgeries in fear of infection. As the speaker told that they were telling if they will come to hospital, they may have infection. So they're very reluctant at that time. And also we were following all the strict protocol of the OPD and surgeries during this period. Under when this in April and May, the hospital was almost closed. But in the June, we started our going to the villages with our camp team because we were not allowed to do the camp. So our team members were going to the villages on the vehicle, and they were starting door-to-door scanning, knocking every household. So this was a great opportunity for us that due to this, we were able to make our message to all the households and doing the counseling also about the COVID-19 precautionary measures. And also we were doing all the eye screening. So all the taking all our precautionary measures, we identify cataract patient and ask them to assemble the next day at a fixed place in the village. And at that time, the patients were gathering at one time, but not more patients. Hardly 2, 3, or 5, 6, 10 patients were gathering at the place. And we were sending our hospital bus and we were bringing them to the hospital for the surgery. So this we followed in some areas. Also, we help to, the COVID-19 help give us an opportunity to have a database. In COVID-19, we approached 66 villages in around the Gaya districts, and now we have a database of 66 villages, how many patients are suffering with which type of eye problem, including the cataract, diffraction error, pterygium, all types of diseases. So this was a great opportunity COVID-19 gave us. That first time we were able to have a database of around 66 villages around the Gaya Eye Hospital, which is we are now using to make other statistics also. And we also adopted another solution. We recruited Netra Mitra. We call community motivators. So we trained them in identification of patients and cataract and other eye problems. And they were having given a mobile app. We developed a mobile app locally with one mobile developer. Software developer in our mobile, and they were given a smartphone, and also through the WhatsApp they were consulting the ophthalmologist if they were not able to solve the problem of the patient, but are not able to identify the disease. So they were taking the consultation with the ophthalmologist over WhatsApp from the village and to the base hospital. So one Netramit was visiting one village, 1 to 2 villages in a day with the mobile app, torch, and the vision chart. And he was giving to the date and time to the cataract patient to assemble at the village at a specified spot. Generally, there were 6 such Netra Mitra. So each one was given one day. Such one was given at Monday, then another side. So the person who was at that for Monday side, he was asking all the patients to assemble on Monday. So hospital vehicle went on that date and brought the identified patient to hospital for surgery. But the turnover is very less. I can say that it was 10 to 20% only. The number of patients are defined for the cataract. Like if you identify around 4,000 patients in the 66 villages for the cataract, hardly 400 patients at that time came for the surgery, 400 to 600. So that's challenges we face, that when door-to-door survey, we get the patient board, but because they do not feel the, as I have seen, they do not feel the intensity or they do not feel the urgency for the surgery. So they do not most turnover. This is our experiences. And also what we have, in the slide you are seeing about the network dashboard, that like one person, every person was going and the app, and it was very efficient application that we were able to monitor the Netra Mitra. How much forms they are filling, how much cataract they have identified, how much pterygium they have identified, other diseases identified, and how much they were able to send to the hospital. So this app was very helpful for us to monitor the performance of the Netra Mitra. So this is what we did to reach the people during the COVID-19. And as other speaker told, that we also are running some vision center, but through the Gaya hospital at the moment we have no vision center, so there is only base hospital through which we are working. And we after September, we also are reaching our normal OPD and number of surgeries also increasing day by day. And but still there is effect of transportation problem. Still there is fear about the COVID-19 among the people. So we hope that by next year we will be able to reach our full strength. Thank you very much.
Thank you, Satish ji, for that wonderful presentation where you talked about the Netra Mitras and the others who are panning out into the villages and ensuring that the people in the rural areas of Gaya, Nawada and Jahanabad, which the Gaya hospital is catering to, are been getting the services at their doorsteps. And that only emphasizes the fact about reaching out to the last person in the community. We'll be moving to question and answers at the moment. And we have around 3 questions in the 3 main, we have quite a number of questions which have come up. So we'll be discussing the questions as time permits. One of the key questions which has come up is around the encouragement, the motivation, and the staff morale Now, this is a question I would request each panelist to just speak on maybe for 2 minutes on what has been the staff morale, how that issues of the fear in the minds of the team members and the others have been addressed, and what has been done to ensure that the staff continue performing optimally, other than the provisions of PPE and others, to ensure that the functioning of the hospitals, the vision centers, continue functioning optimally. Shrikant, maybe we can move to gallery mode and we can have. Dr. Uday, could I request you to kindly share your thoughts? Then we could move on with others also speaking.
Yeah, regarding tensions are there among staff members. One is leading from the front. So when they see us working in the pandemic situation, that gives them feeling that, okay, if the senior most person is working, we can. Similarly, although you said that we need not talk so much about the PPE kits, but when the staff requested for N95 masks, we immediately agreed to their request and N95 masks also to the patients. Then repeated training of the staff on how to deal with the corona situation. So that also played a key role in ensuring that the staff were comfortable. And anytime anybody reported sick, we never asked a question. We said that you better stay home and get yourself tested. At one point of time, 8 or 10 staff members turned positive simultaneously, and then testing of all the staff members for COVID-19, and no more staff members turned out to be positive for corona. So this was what we did. Thank you.
Thank you, Dr. Uday. Dr. Rajesh, would you like to share your views on this?
Yes, Shabit. So thank you. So what Dr. Uday said, yes, leading from the front is one important part. And at the same time, I think, see, initial when the people, the doctor team and the paramedic team was in fear, it was important to give them a confidence. Confidence that management is standing behind them. And in case of anything goes wrong, we are with them. They don't need to worry. We are there to take care of them, one. Second, what Dr. Uday also said about N95 and other things, whatever was the initial requirement, and obviously we give gratitude to all our partners also who supported in procuring everything. But at the management level, initially when it was first lockdown, we procured everything which needs to kickstart the physical OPD in the hospital. So giving them a confidence, one, and second, at the same time, once we start the services, means I personally take that leverage to go around each and every corner and seeing that my doctors and my paramedics are actually following protocol or not. They are wearing proper gloves, proper PPE, proper shield or not. And if I find someone, I promptly tell them, you are not doing right. Go and do first that. So that is also important that they also feel that someone is there to take care of them. Second, with the vision centers, because the challenge comes when we have to monitor the vision centers. So repeatedly we do this, thanks to again COVID, we do this video conferencing chat with them and we take feedback from them. And repeatedly, when they send the orders, we also supply them the necessary PPEs which is there. So the motivation has to be continuous and we need to talk to them continuously. That is important.
Thanks, Dr. Rajesh. Subish, any views on that which are?
Yeah, definitely. I mean, both of them well said. But I think this is the time where management has a great role. I mean, I would say like when a baby tried to walk and the mother calls her to come forward, she walks, even though she knows she may fall, but she'll have a hope mother will take care of it. I mean, that is what something I wanted to say. If in organization create that culture where you are actually being taken care, so I think they'll really come forward and work with a motivation. And I just want to give you an example. Deepavali, I mean, this is a time where you give ex gratia. I'm definitely where are organizations where they have to put salary cuts and all. But then if you look at our management as an example, where they relentlessly say, no, this is the time we have to give, because already they have a lot of sufferings. I mean, I just wanted to mention, these are the times where, they get a real testimony of what the management think, how management take care of all these things. So predominantly, I would say fear or thinking of uncertainty, everything will goes up when you are showing a good example of taking care of everything well in advance, rather they demand for something.
Thanks. Thanks for your viewpoint, Subhish. Aaron and Satishji, would you like to also share your views on that?
Uh, uh, as I told that one of our hospital was converted to the COVID center. So that time, though, because we were regularly visiting in the COVID-19 also, we were not sitting only on the home, but taking precautionary measures. We were all moving to the hospital and the field also personally. So that held up the morale of the staff, because we were always with them. And the second thing, what we did when we converted our eye hospital to the COVID, then with the staff who was looking after the center, he was not allowed to go to the house. He was given a separate room in the hospital itself. And till the hospital was a COVID center, he didn't able to go to the house. So, and he was keeping all the precautionary measures. And by sake of God, that out of our 3 hospitals, only in Hazaribagh, there was infection to out of around 120 staff, 2 staff who were the sweepers, they got infected. And for that, we have to close down the whole hospital for 1 week. So this precautionary measure we took. And also in the, like in Gaya and Dumka, we didn't face much problem, but we were always following all the protocols for the surgery, for the OPD, and all the precautionary measures for the staff and as well as for the patient. The patient were not allowed to enter the hospital without mask, and also all our thermal scanning were taken, and their hand washing was compulsory at the door itself. So these were keeping that the staff were also looked after, that they also follow all the protocols, and the hospital manager and personally myself and our program director, they were regularly visiting the hospital to see that all the morale of the staff are up and all the precautions are taken during this COVID. Also, we didn't cut the salaries, because in most of the hospital, in most of the program, there was cut of the salary. So we didn't cut any salary of the hospital. Only the doctor were given half the salary because they were highly paid. Doctor, we did more than 1 lakh rupees every doctor was getting. So they were given half salary during that period. But none of the staff salaries was cut. So that also make the staff morale high. So these are the precautionary measures we took, and the staff performance was well after the COVID-19, after when the lockdown was relaxed. We see that all the staff were very enthusiastic and very active in their field. So we feel that when the management is with them, their morale is always high. This is my experience.
Thanks, Satish. Aaron?
Yeah, I think most of the speakers have made some very valid and useful points. I do think that one of the things which I felt worked in our favor was because outreach was stopped. So we enforced the transport team to take care of one very essential, and we empowered them to make sure that they were in charge of the hand wash station. So whether it was a doctor, whether it was whether it was any bureaucrat, anybody who would come, they would have to follow those protocols, and I think that helped. And honest communication. So maybe about 4 days before the lockdown, we called for a staff meeting where we spoke to them about the pandemic and about how things are going to be uncertain. And before the lockdown was initiated, we ensured that all the staff who got salary, below a specific pay grade of below 20,000, got their full salary in advance for that month. And then after that, it's like in the first lockdown month, we said that it will be basically deferred. Henceforth, we didn't hold anything back. So that's basically given a lot of motivation to a lot of staff. And making sure that they are definitely as part and parcel of the decision. We were very clear, and we told them that even though we had placed the order for PPE kits in the month of February, but we didn't receive it until the first week of May. So even the hospital we were running with only skeletal staff, in spite of all our efforts. So we had only 3 people or 4 people basically from who were running the hospital at that point of time. And I think a lot of the staff acknowledged that and basically then came forward to go ahead and help. So I definitely think that all of that and the management leading from in front and making sure our medical director going ahead and continuously speaking to the staff and even highlighting the worst case scenario upfront so that they are mentally prepared for anything that is to come. So because we were not sure if the lockdown could happen for 3-4 months, then maybe our course of action would be a lot more different.
Thanks, Aaron, for your viewpoints. Thank you, everyone, for that viewpoint on how COVID and the teams and the staff management and other issues have been addressed. I think a very valid point which was raised by Dr. Rajesh also, which has been asked by one of the attendees, is also around the reiterating the safety protocols. And I think Dr. Rajesh himself also mentioned that that is something that needs also to be led from the front. And it's by repeated trainings, as Aaron and Subhish mentioned, as Dr. Uday mentioned, Satishji mentioned, it's repeated training, motivation, making people understand about the need for the safety, their staff's own safety, their family members' safety, is how we can reiterate and ensure that the safety protocols are followed. We also had a direct question to Dr. Rajesh. Maybe Dr. Rajesh, you can quickly answer this. Is that by what percentage have you increased your hospital and vision center charges to address the cost recovery needs?
Only when we started OPD after the COVID lockdown first time in the month of May, we only revised our OPD charges of the hospital by 50 rupees. Rest all charges are same till date.
Okay, thanks, Dr. Rajesh. This is a question to Subhish directly. Subhish, when you say that IT-enabled DTD survey, door-to-door survey, other than documentation, what were the other innovations that you tried in your setup, if any, and how could they be replicated?
I mean, one important thing is basically what happened with the door-to-door screening programs. Usually you go with the manual system where a lot of things are, eventually to trace back, how many was them, because not everyone come on the particular day for a surgery or something like that. So important thing is, one is paperless. Obviously, we need to be less contact during this COVID time. And second time, it is actually synced with the network connectivity so that every day you get the update of which all location you got, how many got identified. And end of the day, you can also see, and eventually when things all come normal, also you can see actually how many of them came for the surgery and what is remaining, which is sort of ready to serve sort of a community. So that was something. And because even the staff also very much encouraged using this the tablet so that they have no connection with anything. So that was the main thing.
Yeah. Aaron, there was a question directly to you, is that how are you planning to handle the diverse social difficulties which you spoke about in accessing eye care that have developed due to COVID-19?
So in terms of what one of the major issues that we still have, it's an ongoing problem. It's like a lot of the patients in the rural areas are just not getting any form of transport. Like how the others have said, we've tried to send a vehicle, but we have every state has its own state guidelines and norms. Our current guideline is that you cannot have more than 3 people in a vehicle. So that, and if we come without an attendant, that becomes a problem. So we've thought of maybe reimburse, we've gone ahead and reimbursed funds for some of the patients who cannot afford transport. We've even gone ahead and spoken with some of the local NGOs that could help and arrange, arrange transport of patients. And in one recent development where we've worked with the government authorities, they have given us the ambulance and have told us to pay for the fuel. So the cost of the driver will be taken care of by them. It will be one-way transfer. So some of these ways we are trying to reach out to the community, because the people close to the vicinity of the hospital are coming. But people from different districts who need to travel more than 70, 80, 100 kilometers, they are definitely having a lot of problem, because the travel for them is which used to be maybe every twice or thrice a week, now is maybe just once a week, and the rates for that is exorbitant. So a patient would be paying far more for coming. So that's what we are currently trying to do.
Thanks, Aaron. Satishji, this was a question directed to you based on your presentation and the wonderful work that you're doing in the villages of Bihar. Is that what is the difference in the urban and the rural population in terms of the community attitude to eye care? Do you see any?
Yes, because mainly we're working in the rural areas, and mainly all the camps are in the rural areas. So we see that only 10% patients from the urban areas are coming from the in our hospitals. Mainly the rural patients are coming. And the second thing, we are feeling that the patients in the rural areas are in cataract or in avoidable blindness for years and years. Because of the accessibility and no one to isolation and no one to reach them. So they are in blindness for 2-3 years, and we have to bring them. Otherwise, they remain in the villages. So this is the problem. In the urban area, people come by their own, but in the rural area, they live in the blindness because of the poverty, because of the accessibility problem, because of the transport facilities, because of the poverty. So we have to adopt different strategies for urban and rural areas.
Thank you. Dr. Uday, would you like to answer this question which has come up? Is there any updates on the prevalence of blindness post the COVID-19 pandemic? Where are we in terms of numbers?
I don't think no such statistics come up so
Dr.
far.
Uday, you're mute.
The performance has dropped all across the country, and as Subish mentioned, there is no clear data available anywhere. But I guess that the overall performance is in the tune of about 25% of the normal performance. But let me tell you the same thing a little differently. My friends in private practice are telling me that they are seeing a lot of mature cataracts nowadays. So the backlog has definitely increased. But yes, we don't have the figures.
We have overrun our time by quite a few minutes. And thank you everyone for staying on in spite of all your schedules. This is the last question that we thought we'll just take everybody's opinion on. Is that if there was a message that you would all like to give to all these stakeholders and all the various institutions who are listening in, is that what would you like to give as a key message is how to go about re-strategizing and leveraging the changed adaptations to deliver results to the last person? What is the key one thing that has to be done?
Strengthen vision centers.
Okay. Thank you, Dr. Uday, for speaking about vision centers. Dr. Rajesh, what would you?
Stay with your mission and vision with empathy.
Okay, you are highlighting the need to be empathetic to the cause and to continue on the path that is there. Subish?
Taking well care of the employees and obviously adapting the changes, which is inevitable.
Okay. Thanks, Subish, for your views on the employee engagement and the employee welfare. Satiji, you wanted to speak?
There is not only one solution to any problem. There are multiple solutions, and we should try all of them mostly. And second thing, I have noted that the human being is most adaptable animal in the world. They can adopt all types of disaster, and they stand up on them. So that is my message.
Thank you for that wonderful message of trying out all approaches and keeping an open mind to adapt and to move on. Aaron, last comments from you.
Right. I think not to lose hope at all. The World Sight Day theme, even for this year, is hope in sight. So I think we need to find that we should be togetherness in all of this adversity, and make sure that collaboration is going to be key. Like going ahead in terms of like for every organization.
Thank you, Aaron. I think you summed it up very nicely. And when you spoke about hope and you spoke about collaboration, because I think these are the two key elements that is coming out, be it in the eye health arena or be it across all developmental aspects, that we need not lose hope and we need to collaborate with one another, with partners and others with whom maybe we have not collaborated earlier, to ensure that the eye care and the other delivery mechanisms continue as it was or as per the new normal, and continue the services so that the person in the remotest part is able to get the services. Thank you all. With that, we'll come to an end to this wonderful webinar, which was attended by a lot many participants from across the country. We hope it has been useful. We have not been able to answer a few of the questions which came up on the chat box and on the Zoom tabs also because of paucity of time. However, we have taken a note of all those questions and we will try and answer back to all of you. Thank you, everyone.
Thank you so much. Thank you so much.
Thank
you.
you, everyone. Thanks a lot to Mission for Vision team.
And my namaste to all the speakers.
Thank you, Uday.
Ji, sir.
Thank you, Sudhir ji.